So, good morning to each and everyone. So, here are my topic which are about the pedophilic, sexual masochism, transvestic, and voyeuristic disorder. So, here are the objectives of my report. First, identifying disorders. Number two, understanding the disorders. Number three, the difference between pedophilic, sexual masochism, transvestic, and voyeuristic disorder. So here are the outline of content: pedophilic disorder, sexual masochism disorder, transvestic disorder, voyeuristic disorder. So let's move on to the first topic, which is the pedophilic disorder. So pedophilic disorder is characterized by recurrent intense sexually arousing fantasies, urges, or behavior involving prepubescent or young adolescent. It is diagnosed only when people are 43, more than 16 years older, and more than 5 years older than the child who is the target of the fantasies or behavior. So, pedophilic or pedophile is a person who has a sustained sexual orientation towards children, which is form of paraphilia that causes harm to others and is only targeted people are in 16 years older and 5 years older than the child. Most pedophile are male attraction, maybe to young boys, girls, or both. In most cases, the adult is known to the child and maybe a family member, step parent, or a person with authority. Looking or touching seems more than prevalent than genital contact. So, in this case, the other targeted of this both children and adult. In conventional usage, is psychosexual disorder generally affecting adults characterized by sexual interest and prepubescent children or attempts to engage in sexual act with prepubescent children. So karamihan na nakaka-experience ng pedophiles are male na maaring mismong lalaki ma-attract sa batang lalaki or ma-attract sa batang babae. So, in most cases, nangyayari ito in the family related mo lang yung may connection ka sa isang taong gagawa sa iyo ng hindi magandang pamamaraan. So, may iba't iba silang way they more looking for you or in secretly they are touching you. So, pedophiles may be attracted only to children or also adults. Some are attracted only to children who are related to them. Predatory pedophiles, many of whom have antisocial personality disorder, may use force and threaten to physically harm the child or the child's pet if the abuse is disclosed. The course of pedophilia is chronic and perpetrators often have or develop substance abuse or dependence and depression. Pervasive family dysfunction, a personal history of sexual abuse, and marital conflict are common. So, ang pedophiles daw may attract to the children or may attracted to adults. So, once a person is attracted to the child, it may be because they are related or they are have a connection to each other. So, predatory pedophiles is um, yung may they may use force or coercion yung pipilitin kanila, so they are going to threaten you para mapilit nilang isang tao na mag-engage in sexually. They may threaten to harm the child or kung sino man na may connection sa bata ay it gagawin nilang panakot sa iyo kung ano yung connected sa iyo. If for example, if di ka papayag or kung sasabihin mo sa ibang tao kung ano yung ginawa sa iyo. So, yun ang nagiging dahilan ng antisocial personality. Maybe because you are afraid na malaman nila kung ano yung nangyari sa iyo, or maybe you are afraid na mangyari sa iyo yung nangyari sa iyo ulit. So, that's why hindi ka nakikipag-contact sa ibang tao. So, you become antisocial personality. So, let's move on to the sexual masochism disorder. So, social masochism is intentional participation in an activity that involves being humiliated, beaten, bound, or otherwise abused to experience sexual excitement. Sexual masochism disorder is sexual masochism that causes significant distress or significant impairs functioning. So, ang sexual masochism daw is anong causes of significant distress or significant impairs functioning of a behavior. So, it causes of distress or impairs of functioning. Distress yung nababalisa ka or yung behavior mo hindi nagfa-function ng maayos. So, dahil sa pagkabalisa mo, naiisip mong makisama or sumali sa mga gawain na hindi kaaya-aya tulad ng pangbubugbog, humiliation or anumang klaseng pang-aabuso na magiging kadahilanan ng pagkapinsala sa iba. Sexual masochism is form of paraphilia, but most people who have masochistic interests do not meet clinical criteria for a paraphilic disorder, which require that the person's behavior, fantasies, or intense urges result in clinically significant distress or impairment. The condition must also have been present for more than 6 months. So, ang sexual masochism daw is also form of paraphilia. Pero karamihan daw dito is kanang hindi nila matugunan ang kanilang pamantayan. Parang hindi pa nila masyadong nakikita if you are truly under of sexual masochism. So, oobserbahan ka muna nila if talagang nararanasan mo yung symptoms ng social masochism. So, sadomasochistic fantasies and sexual behavior between consisting adults is very common. Masochistic activity tends to be ritualized and long-standing for most participants. The humiliation and beating are simply acted out. Participants know that it is a game and carefully avoid actual humiliation or injury. However, some masochistic increase the severity of their activity with time, potentially leading to serious injury or death. So, ang sadomasochism, people those are old enough and at least they have a little knowledge that abuse is bad. So, for them, ginagawa nila yung abuse as a game. Hindi nila just they do this just do it as a game. Yes, nananakit sila ng ibang tao pero hindi yung masyadong too much, yung hindi nila idadaan sa patayan or sexually yung masyadong masasaktan yung victims nila. Pero because of the effect of sadomasochistic, maaaring yung some of the masochism increase severity which led them to serious injury and death. So, pag masyado silang na-involve sa sexual masochism, maaari itong maging dahilan ng pag-increase ng kanilang maaaring serious nilang nasaktan ng ibang tao or maaring humantong ito sa patayan. So, masochistic activities may be the preferred or exclusive mode of producing sexual excitement. People may act out their masochistic fantasies on themselves. So, sometimes a masochistic there are people that because of sexual excitement, dahil sa masyadong sexual of excitement nila, yung ginagawa nila sa ibang tao maaari din gawin nila sa kanilang sarili. So here are the example kung ano yung ginagawa nila sa iba na pwede rin gawin nila sa kanilang sarili. The first one is binding themselves, piercing their skin, applying electrical shock, burning themselves, bound, blindfolded, spanked, flagellated, humiliated by being urinated or defecated on, forced to cross dress, and part of a simulated rape. So, diagnosis of sexual masochism disorder is based on specific clinical criteria from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. So, ang DSM-5, maaari daw ma-diagnose symptoms ang isang tao once na ma-observe mo yung kinikilos nila. For example, this one, patient have been repeatedly in intensely aroused by being humiliated, beaten, bound, or otherwise abused. Arousal is expressed in fantasies, intense urges, or behavior. The second one, their fantasies, intents, urges, or behavior causes significant distress or impairment functioning at work, in social situation, or in other important areas. The condition has been present six for for less than 6 months, or treatment of sexual masochism disorder is often ineffective. So let's move on to the transvestic disorder. So transvesticism involves recurrent and intense sexual arousal from cross-dressing. So cross-dressing means cross-dressing means cross-dressing means wearing clothes with opposite gender. So, which may manifest as fantasies, urges or behavior. Transvestic disorder is transvesticism that causes significant distress or significant functional impairment. Transvestism is a form of paraphilia, but most cross-dressers do not meet the clinical criteria for a paraphilic disorder. These criteria require that the person's fantasies, intents, urges, or behavior cause distract or impair functioning or harm others. The condition must also have been present for less than 6 months. So, ang transvestic disorder daw is a condition in which there is a persistent which they experience recurrent intense in sexual arousal from cross-dressing. So, yung parang na-expose sila sa cross-dressing. So, like I said kanina, cross-dressing is yung uh, sakit sa pag may nakita, means wearing clothes with opposite gender. Lalaki ka, pero parang pag may nakita kang na ba, ano yung ibig sabihin, paano ko ito masabi? Pag may nakita kang isang pangdamit babae, din nagustuhan mo, parang hindi ka matatahimik hangga't hindi mo nakukuha yung damit, hangga't hindi mo nasusuot yung gamit. There are seasons eh. Sometimes ang season ng cross dressing is yung gusto mong bumili ng isang damit pang babae. Then once na gusto mong itong hindi mo ito susutin once na dumating yung season na gusto mo nang tigilan ang cross-dressing. So some scholars believe that transvestic fetishism should be removed from the International Classification of Disease or ICD at the next revision, even though some men who cross-dress do some compulsively and are distressed and impaired by their behavior. Cross-dresser is a more common and acceptable term than transvestite. Cross-dressing and transvestic disorder are extremely rare in birth sex females. So, ang mga scholars daw is naniniwala sila na ang transvestic is pwede siyang tanggalin sa uh, ICD. Kasi ang cross-dressing daw is common. Means common daw para sa kanila kasi yes, kasi minsan para sa kanila pag may nakita silang a man who wear a cloth of women, sasabihin nilang gay, pero hindi yon because minsan common talaga yan sa atin, pero um, as long as that person is experiencing symptoms of transvestic, maaaring masabi na itong na-diagnose na siya sa sinasabi nating transvestic disorder. So, Heterosexual males who dress in women's clothing typically begin such behavior during late childhood. Up to 3% of men have cross-dressed in being sexually stimulated by it at least once, but Far fewer report regular cross-dressing. Cross-dressing is associated, at least initially, with intense sexual arousal. Sexual arousal that is produced by the clothing itself is considered a form of fetishism and may occur with or independent of cross-dressing. Personality profile are cross-dressing. Men are generally similar to age and race match norms. Most people daw who groceries are heterosexual. So minsan minsan talaga ang groceries is once na sa childhood mo ginagawa mo na ito, maaring yun ang maging epekto sa'yo kasi naranasan mo na siya. Yung childhood, kumbaga childhood mo din sa paglaki mo. Kung ano ka sa bata, sa paglaki mo, magiging posible na magiging ganun ka rin. So, when their partner is cooperative or willing to participate cross-dressing, men may engage in sexual activity in partial or full feminine attire. When their partner is not cooperative, they may feel anxiety, depression, guilt, and shame because of their desire to cross-dress and may experience sexual dysfunction in their relationship. In response to these feelings, these men often purge their wardrobe of female clothing. This purging may be followed by additional cycles of accumulating female clothes, wigs, and makeup with more feelings of shame and guilt, followed by purges. So, minsan ang taong may transvestic is suffering in anxiety, depression, guilt, or shame because of their urge to cross-dress. Minsan yung mga yan ang nagiging resulta ng hindi pag-cooperate ng partner nila sa yung taong gustong mag-cross dress tapos hindi nila papayagan. They may experience anxiety, depression, or guilt or shame. So let's move into the last topic, which is the voyeuristic disorder. Voyeuristic Voyeurism is a treatment of sexual arousal by observing people who are naked, disrobing, or engaging in sexual activity. When observation is of unsuspecting people, this sexual behavior often leads to problems with the law and relationships. Voyeuristic disorder involves acting in voyeuristic urges or fantasies with a non-consisting person or experiencing significant distress or functional impairment because of the such urges and impulses. So, ang voyeurism daw is defined as an interest in observing unsuspecting people while they undress, are naked, or engage in sexual activities. The interest, this interest is usually more than in act of watching rather than in watching personal. So, sometimes daw ang voyeurism is lead to deep problems, especially to sa mga uh, relationship sa may mga ka-relation na isang tao kasi it more become para kang nagiging sa this situation is parang stalker ka kahit nasaan yung isang tao, you're always following with them whether they are in a house or kahit nasaan sila, basta always kang nasa kanila, you're always watching kung ano yung ginagawa nila, even their private activities or private in life. So you're always nandoon ka, you're always active para lang parang a stranger na hindi hindi ka nila unsuspecting, kumbaga hindi ka nila sinususpect malalaman hindi ka nila sinususpect na you are basta malalaman na nila susunod na pangyayari na that you are spying on them. Voyeurism is form of paraphilia, but most people who have voyeurism interests do not meet the clinical criteria for a paraphilic disorder, which require that the person's behavior, fantasies, or intense urges result in clinically significant distress or impaired functioning or cause harm to others, which in voyeurism includes acting on the urges within non-consistent persons. The condition must also have been present for more than 6 months. So, ang voyeurism daw is also a form of paraphilia na tulad din sa transvestic na hindi rin nila kinakailangan na uh, ma, ma-meet hindi nila kinakailangan na ma-meet na ma-meet the clinical criteria for a pedophilic disorder. So, ang kinakailangan nila na obserbahan kung yung behavior nila, fantasies, or intents, or just result in clinically. So, ito rin yung ang dahilan din nito is pare-pareho lang sila ng dahilan, distress or impaired functioning or cause of harm others. Maaari ditong maging maaari din silang maka-harm, maka-apekto sa iba kasi minsan once na malaman mo na they are spying on you, then iiwasan mo sila. Once na hindi ka nila ma-achieve, maaaring hanap-hanapin ka nila or may gawin silang hindi kaaya-ay pangyayari sa'yo because of their desire to watching you. Desire to watch other is in sexual situation is common in not in itself abnormal. Voyeurism usually begins during adolescence or early adulthood. Adolescent voyeurism is generally viewed more leniently. Few teenagers are arrested when voyeurism is pathologic. Voyeurs spend considerable time seeking out viewing opportunities, often to the exclusion of fulfilling important responsibilities in their life. Orgasms is usually achieved by masturbating during or after the voyeuristic activity. Voyeurs do not seek sexual contact with the people being observed. In many cultures, voyeurs have ample legal opportunities to watch sexual activity or e.g. digital or print pornography. However, voyeuristic behaviors are the most common of sexual behavior that may result in a brush with the law. Viewing sexually explicit pictures ensures now widely available and private on the internet is not considered voyeurism because it lacks the element of secret observation, which is the hallmark of voyeurism. So, diagnosis of voyeurism disorder requires the following. So, diagnosis symptoms of voyeuristic disorder is this following. So, maaaring masabi mo na that she's under of voyeuristic disorder when the patient shows that she's been repeatedly and intensively aroused by observing an unsuspecting person who is naked, undressing, or engaging in sexual activity. Arousal expressed in fantasies, antics, urges, or behaviors. Patients have acted on their urges with a non-condescending person or these fantasies, intents, urges, or behaviors cause significant distress or impaired functioning at work, in social situation, or in other important areas. The condition has been present for more than 6 months. So, that would be all for today. Thank you for listening to my report. And